Welcome to Season 5 of Purposeful Empathy, a show dedicated to amplifying the voices of people from around the globe who understand that the world needs more empathy and are doing something about it. Today's episode was brought to you by Grand Huron International, an on-demand coaching provider for individuals and companies. Thanks for watching the show. Enjoy. Welcome to a new episode of Purposeful Empathy. Today I'm joined by Charles Onu, who is the CEO of Ubenwa Health, a startup applying AI for reliable, low-cost diagnosis of perinatal asphyxia. Charles Onu is interested in how technology can address difficult problems in medicine. He's also a PhD candidate at McGill and the Quebec AI Institute, otherwise known as MILA, where his research broadly focuses on developing novel applications of AI in medicine. It's great to have you on the show, Charles.
Thank you, Anita. It's a pleasure to be here.
Now, I've known you for a number of years. I'm trying to do the math. I think it's probably 7 years already since we met.
Yeah.
Yeah. So, okay. And you came to
six, I think 6 plus.
6 plus. Okay. So I must have been pregnant with Annika when we met. Is that right? Okay.
Exactly.
So under the auspices of the Jean Sauvé Foundation's leadership program, you were a fellow from Nigeria, and you came to Canada to really focus on your venture to solve this important medical problem. So can you tell us a little bit about your backstory and then what led you to Canada and what your goal at the time was?
Yeah, totally. So I'll just start by, explaining what we're doing today and then walk back to how did I come to this.
Sure.
So first, Ubenwa, our social venture is focused on developing low-cost diagnostic tools for birth asphyxia. Birth asphyxia is when the baby is unable to establish spontaneous breathing after birth. And this will be caused by myriads of factors, but the important thing is it is one of the top 3 causes of newborn mortality today. It causes over 2 million deaths and disabilities every year. And a lot of this is happening in developing countries. And we find that most of the cases are just due to late detection of the condition. So we are really focused on how can we leverage modern technologies to develop something that's more accessible, cheaper, faster, that birth attendants, midwives can use, even without the presence of fancy medical equipment, to screen babies quickly and get them to have the care they need. So how did I come to work on Ubenwa? It's a really long story, and I'll cut some parts of it. I just give the broad strokes of it. But I guess it starts from growing up in Nigeria and just easily seeing around me that I was privileged. My family wasn't wealthy, but we were in the middle class, and we could see that more than half of the country was struggling to survive in many aspects. Because I could see that our economy, our infrastructure, many things were not just working well. But I'll say the thing that struck me the most was the problems in healthcare. Like, for some reason, as a child, I just thought that, see, if we couldn't provide something as basic as healthcare to people, then people don't even have the life to struggle and to hustle and make themselves the daily bread. And so for me, healthcare became like one thing that was really important growing up. And I remember telling everybody I was going to be a doctor, my parents, friends, family, everybody. But when it came time to choose to study what to study in the university, because in Nigeria, you go straight to medical school if you don't do a first degree first. When it came to that time, I realized that I didn't actually want to study medicine because I loved math so much. And I couldn't imagine a life without doing mathematics. I thought it was actually a hard choice, very difficult one, because I wanted to be a doctor. I wanted to be able to contribute to helping people, saving lives, and so on. But then I had come so much in love with math and physics that I was hard to not be able to do those things going forward. And so fortunately, with the help of friends, family, cousins who were already in university, I was able to realize that doing engineering, following the theme that I really cared about scientifically, what didn't necessarily mean that I couldn't impact medicine. And so I ended up going to study engineering. And so for me, studying engineering was never really about like, doing engineering, but using that to find how we can solve problems in society and solve problems that were around me, especially in healthcare. And so that led me in through volunteering with NGOs while I was in the university and after university, and just like really trying to get a pulse on what are the problems, what are the ways we could approach them based on what we know from engineering and science, and so and I'm skipping many steps, but that really led me to working on this problem of how can we reduce infant mortality using technology, using mobile technology, AI, and the likes today. And so that's the storyline in short.
So, two little follow-up questions. I want to know, what do you attribute your empathy to, given that you really wanted to help people in healthcare, right? So you wanted to be a doctor because you want to heal people, and then you realized you didn't want to be a doctor, but you now want to leverage technology to help people. What was it already from the very beginning that motivated you to want to like leverage your empathy for others? That's the first follow-up. The second one, I have completely forgotten. It'll come back to me as you're answering the first question. Okay. That's hilarious.
I mean, it's easier for me to, because if you gave me two questions, I will forget the second one by the time I'm done with the first one.
Great. Okay. Yes. It is Friday afternoon for everyone as we're taping this.
Yeah, but totally. On the question of why did I decide that I should use my skill or try to solve the problems around me. I think it really came down to that feeling that I was just lucky. I was lucky to be born to parents who were not educated, but who had, worked hard enough and developed enough means to send me to school and to provide basic things for me. To, like many of my friends will go from school to their parents' shop to go and sell things, and they have no time to study. But my parents made sure that, we went from school to home, we could do our assignments and things like that. So I realized I had many privileges that were just sheer luck. I did not make any choice. I did not make any effort to earn those privileges. And so for me, it just really felt like a responsibility I had to the others around me to give back, to try to use the short time we have here on Earth to help, make others, close to or better than where we find our own selves. And yeah. I guess it was just as simple as that.
Yeah, a sense of responsibility. I hear you on that. The second question that I wanted to ask was, healthcare is so broad, and you're talking about something very, very specific. I mean, you mentioned the stats, still 2 million people is a lot, but how did you come to focus on that particular medical issue?
Yeah, so I ended up focusing on babies by, mere happenstance, I'd say. I mentioned earlier that, after making this choice to study engineering, I still wanted to make sure I stayed connected with the community, with social work and so on. And so I was volunteering with NGOs throughout my stay in the university and even after the university with colleagues as well. And it was during this time that, we had projects in environment, in energy, in healthcare. It was during this time that I came across this problem of birth asphyxia that I'm working on today. In some projects with nurses and midwives, and I guess of the ones that that we encountered, this was one that I felt I had some some scientific edge coming into, and I could see a way to tackle this problem from my own previous work. Because in my previous work in my undergrad, I had studied about how we could the information in the newborn cry. So I was learning about the fact that the baby's cry is just this sign that we use to say at birth if the baby is alive or not. But that cry at birth is so much more informative than we actually know. And the cry goes on to tell us things about the health of the baby, whether they are hungry, whether they are sad or sleepy. And I had done some work on this before. And so it was like this prior work and then realizing the problem at hand. And I realized, okay, so maybe I could combine the things I had done before to this new challenge to potentially bring a solution. As with most things in healthcare, I thought I would do it in a shorter time, but it has become many years of work because, yeah, everything in healthcare takes time for good reason and for realistic reasons as well. Humans are involved. Clinical studies have to be done. You can't solve a healthcare problem in your bedroom. You have to actually build coalitions, work with doctors, and so on and so forth. So I usually say that if I knew the Herculean task I was embarking upon, I would probably have run away.
Yeah, you're
So
not the first.
yeah, I saw each small hill and I was like, okay, I'll climb this one and climb, and I kept seeing more and more ones opening up, basically. But,
Yeah, I hear that from a lot of social entrepreneurs, and it makes me think of something that I was going to say, which is, a lot of the interviews I've been doing on this podcast and for this series have been with people who are quote unquote empathy experts, who've actually studied empathy, either behavioral psychology or neuroscience, or sometimes it's in the professional space where they're ethnographers. And I see your work as sort of empathy adjacent. I think all social entrepreneurs that are doing work in service to humanity and the well-being of our planet or our fellow human beings is the work of purposeful empathy. So that's how I see your work as adjacent. And I'd love to do a little bit of a deep dive into your social purpose venture. So how you got started, some of the, twists and turns. Where are you at now? What are some of your needs? What are some of your goals? How are you planning to scale? So just, want to hear more about the organization.
yeah, totally. I'll try to cover most of these questions. But, one of the first things I'll say is that, um, and this ended up being a pro and a con at the same time. Because I never started up trying to start a company or trying to start a social venture. It was just a problem, a potential solution I had in mind, and a project that could be worked on at that moment. And it kept evolving from there. And so it was a pro because it didn't allow me to really just pause and realize the gravity of what I was getting myself into. But it was a con in the sense that I made a lot of mistakes along the way and not like planning ahead enough and only getting there and realizing that, oh shit, I have to have done this and that, and then, cost time and so on. But all in all, I went from, first of all, working on this on my own to realizing that, oh yes, there was something inside of here. And one of the very first things I did, I was still in Nigeria by this time, at this time, by the way. One of the first things I did was to look at doctors who were working on this problem, who had investigated it in their own research, birth asphyxia. And I went to their universities. I tried to schedule meetings with them and to speak with them, to pitch the idea to them that we could develop a cry-based diagnostic tool that will be so cheap because everybody has phones in their hands and it would cost little to nothing to make it available. And I tried to explain to them the physiology behind the baby's cry and why this was possible, because the cry is connected to the central nervous system in newborns, and because they don't have voluntary control over their cry, whatever is happening in the brain is reflected in the patterns of their cry. And so this is a really, like, thankfully very successful conversations. I got the first set of clinical partners that I worked with to prove the concept, to do a small study on a small number of patients to show that there were signs in the cry that could be leveraged to develop a really robust tool. Yeah.
So let me just interrupt for a second, because I think I have a bit of an advantage knowing your work from years ago. Anybody who's listening or watching, just to be sure that we're talking about the same thing. You developed a technology, or were thinking about a technology, where in the space of a newborn baby being born into the world, you'd hold up a phone, a cell phone, and you would hear the baby's cry, and that signal would get analyzed some way, somehow. Is that it?
Exactly. And it would tell you if the baby was at risk of brain damage from birth asphyxia and other conditions that we are looking into now. So that's essentially the core idea. Using a phone, take the cry as input and let the caregivers know if there is a problem. And if there's a problem in asphyxia, but two ways in which it has expanded is we've moved from not only smartphones to even custom devices we're working on now. And we've also moved from just birth asphyxia to working on other neurological conditions as well that can be detected from the child. So
That's amazing. So you're working with neuroscientists right now. So is your PhD in neuroscience?
No, my PhD is at the corner of computer science and biomedical engineering. So it's the crossroads of both.
How
But
fancy.
of course, like I work with neurologists, I work with neonatologists, pediatric neurologists, and so on as well. So it's all connected.
So who's funding the research and who's funding the devices and who's funding the scaling? How's that all working?
Yeah. So funding was actually a big problem for a long time. Starting the project just alone meant that I was just trying to keep expenses and costs as low as possible. But at some point, when it was clear that to make progress, we needed to conduct clinical studies. Clinical studies means working with doctors to be able to collect data of actual patients over time. Because the way these AI or machine learning systems work is that to detect the problem, you need examples, you need data of patients that have the problem and patients that don't have the problem. And then it's from this that the algorithm learns the patterns of anomalies and the patterns of healthiness and is able to use that for the future. And so to collect examples of babies that are normal and babies that had asphyxia, the only place to do that was in a hospital. But you can't just walk into a hospital with a phone to collect that data. So that meant forming collaborations with physicians, applying for ethics approval, which is a good thing that that's there because even though we need research to improve the lives of patients of the future, we shouldn't hurt the lives of patients of today when doing that. But that's a really long process. The ethics review process it could take a year at least or more. And so today we have about 6 hospitals working with us here in Canada, in Nigeria, and in Brazil. And so the idea of working with these hospitals is to get data from diverse locations, data from different geographies, so that we can be sure that whatever tool we develop is going to scale beyond just one particular location. And so in terms of and so basically over time, the team has grown from just a one-man team to now about 6 to 7 of us. Who is funding us? We've been bootstrapping still for the most part, with small grants from the government of Quebec. They were our very first investor, if I'll call it that. The very first dollar we got was from the government of Quebec, and also the federal government of Canada as well now, from MIT in the US, from other foundations as well, like the Patrick McGovern Foundation. So we've been able to work so far with a pool of small grants from different partners who believe in us, who support us, and even Mila too have supported us as well in kind. And so that helped us, yeah.
And are you seeing success? Are babies' lives being saved? Can you share a little bit about that?
Yeah, so we are still in the latter part of the R&D, I would say. So COVID actually caused a halt in most of our clinical activities because, understandably, that was priority. So we did shut down for about 6 to 7 months at a different sites. So what we are in like 60% through the clinical studies. We're beginning to analyze the data we have now, and we are seeing that yes, we can develop because the idea of this now is to validate the prototype that was developed earlier, and we are seeing that we can maintain that performance we had in the original prototype. So beyond this step, we'll be actually taking the tool and then using it in controlled clinical trials, much like the way vaccines are developed, where you prototype in the lab, test it, develop it, and then they do trials with actual humans in a controlled way, though. And so that will be the next step for us, before we can actually put it into everyday use. Because it's in the clinical space, and there's all these steps that it has to take to be an approved medical device that can be used safely. Yeah.
Right. One of the ideas, and this is the fundraiser in me thinking, and as a mom who had a child, I have a very distinct memory of what the first sound that my baby made. It was like 3 little cat meows. That's the closest thing I can describe it to you. It's like 1, 2, 3, a little cat meow. I wonder whether or not it would be possible to tape that first sound and, not sell that sound to the parents, but say, this is a gift we offer. Would you like to make a donation to your project? Like, I think there might be like an opportunity there, but we could talk about that offline.
That's an interesting twist.
You know how parents like to have their, footprints and fingerprints and clay? Well, they could also have a little audio file. So as you've been going along this journey as a social entrepreneur, and you're, collecting data, working on trials, the idea is eventually to scale. I'd like to hear your thoughts about self-compassion and self-empathy, because people who are on the front lines of humanitarian work or social work, where you're in a service provision kind of role, or in your case, you're imagining, for every extra day I spend developing this, I'm not saving those X number of babies. Like, there's an urgency by which you want to get this technology out there. How do you take care of yourself? And how do you kind of, find your own, self-care mechanism?
Yeah, no, that's a very important issue, actually, because for many of the first few years, I was like working night and day, or there was at least no boundary between night and day for me. It was just take breaks to eat and then try and get back to working on something, whether it was the actual, algorithmic work, whether it was finding clinical partners, whether it was finding funding. There was always something to work on, and so it was just a circle round and around. But what that led to was, I would work intensely for like 6, 7 months, and then have a breakdown like for another 3 weeks or so. And breakdown, meaning, I just would wake up, I couldn't work because I had exhausted my mental abilities. And then I needed to actually just stop working for like a significant time to recover again and be able to continue. And needless to say, that was not healthy. And one thing I'm getting better at doing in the last, I'll say 1 year plus, and so is really, because there's a temptation, right? When you do, especially work that involves just staring at a computer and typing away, it's a temptation to feel like you can work anytime because the office is with you every time. And so it's really just now about drawing that line and saying at a certain time of the day, work is done. Do anything but work.
I hope sorry, didn't mean to cut off.
Because it's going to be there tomorrow, the next day, like it's not going anywhere, right?
I hope I'm the last of your to-do list today on this Friday afternoon at 4:35 p.m. Oh, good. I like to ask the question often on behalf of a younger generation coming up the pike. There's so many ways that they can develop their careers. And as you know, somebody who's trying to nudge them in a direction of be of service to humanity, what recommendations and what benefits does it have, do you see for young people to think about work as a social entrepreneur or something like that?
Yeah, so I mean, many ways to go at this from, but one of the questions I would say is, like a person has to be doing it because they want to do it, doing social work or like working in social space because they want to do it. Because like with everything, there will always be hard times, and those hard times are going to test you significantly, and if those times come and you look around you and you cannot justify why you're here, it will make it even worse. It could make you go crazy or do something else, So I say first, it has to be something one wants to do. It also has to be something like in terms of the destination, first of all, it has to be something you desire, but then it needs to be using your skills in a way that excites you as well. It needs to be drawing from something you already enjoy doing. Because I could totally see myself, like if I'd gone to study medicine and been a medical doctor, just not liking my day-to-day work, and always wondering what would have been like, solving all those math problems
I was just
that
gonna
result
say.
into algorithms, But the fact that, and it's a gift too, I think, for me, just to be able to do what I like solve math, and easy to solve problems in the real world, like healthcare, and not just like solve math for the sake of, academic purposes only. And
Got
so I
it.
think like if one could get to that point, that would be a very nice destination to be at. Doing something you like and love, and you're using that to solve a problem that you care about as well too.
Yeah. And how do you benefit? What's your personal benefit from the work you do?
Uh, I'd say it's that. It's just that, like that peace of mind, especially when those hard times come. And I look and I'm like, I cannot think of anything better, anything other that I would want to be spending my time and my skills on. And so when those hard times come, I just sleep it off.
Nice.
I wake up the next day and continue because, like, I would not be, I would rather not be doing anything else. Basically, there's nothing else I'd rather be doing.
Sounds like you have a real sense of purpose, which is beautiful. So, as a last question, Charles, and thank you so much for your time. I like to ask my guests at the end of the podcast a question about their personal life. If you can think of a time when you were on the receiving end of empathy and what that meant for you.
So there are two things I'll say. And one is light and one is not very light. It's not very light-hearted, precisely. And I'll start with the not very light-hearted one, so I can end with the light-hearted one.
Okay.
And this is not exactly me receiving empathy, but in some ways it's like that too. And this is really about data and medical research. In our work, for instance, we end up, working with cry samples, actual cry recordings of babies that were taken after they were born, before they were discharged from the hospital. And it's very often, it's easy, especially in the computer world, to just see this as data, as numbers, as statistics. And that happens to me all the time, I have to say too. It's just the data you work on to solve this math problem. But I remember one recent incident where it was almost like one of the babies spoke to me, if I'll put it like that. And because occasionally we would listen to the audio samples for like auditory analysis or to trace some issues. And so I was just listening to a set of samples of babies, and I saw that this baby, we had a birth recording, but we didn't have a discharge recording of this baby. And so I went to look in the spreadsheet to see why there was no discharge recording. And it was that this baby had died. And it wasn't the first time I was seeing that we had diseased patients in our database. But for some reason, just listening to that audio and looking for the goodbye audio, like the one that says the baby is going home, and not finding that one, it's just like is a moment that made me to pause. And it was almost as if the baby said to me, this was my first and last sound to the world, and I'm going, but please use it to help the babies that come in the future. And so that was a very, very, it made me really pause. And I see it.
It's a very touching story.
Yeah. So it was definitely one that stays with me. It wasn't the first time, but it was that particular baby, that particular moment was a special one. And I don't know why. So there's that, and then there's the more light-hearted one, which connects back to the beginning when you said we met at the Solvay House, the Jean Solvay Foundation. And coming to Solvay for me was the first time I was living in a country outside of Nigeria. I had never seen snow before and many other things. And I remember that year, the snow took forever to come. It was like, it knew I was there, it knew I was waiting. And all the Solvay fellows, they knew that I was waiting for the snow too. And so every morning, where's the snow, where's the snow? And then it was the day the snow, that the first snow fell that year, 2015, like half of the residents of the house came to my door, knocking like, Charles, come and see. And so that was very much fun. The fact that experience was shared with everybody, and and everybody was anxious for me to get this snow experience. And it was so much fun. It was nice. And as you might know, snow is only nice the first time. Afterwards, the winter gets.
That is a fabulous story. Oh my gosh. And I'm so happy you said it in that order. I guess that's the Nigerian storyteller in you that knows when to say what. Charles, I am so happy that we reconnected. Thank you for sharing your journey. I'm going to include lots of information in the description below about how people could learn more and get in touch with you to support the work that you do. Thank you for all of the math that you're doing in service to saving lives and making a big impact in the world. So I really appreciate your time, Charles.
Yeah, thank you, Anita. It was a pleasure as always. Take care.
Mm-hmm. Thank you for joining. See you next time at Purposeful Empathy.
What if you had access to your own council of coaches to help you break free from your thinking clutter, or make an important decision, or liberate you from whatever's holding you back? At Grant Huron International, you get to choose the coach of your choice from any place, anytime. Visit granthuroninternational.com and harness the power on-demand coaching today.